Hey, this is Doug Field, CEO of the Institute for Healthcare Consumerism, along with my guest host, Sanders McConnell with HSA Bank, and welcome back to this segment of Healthcare Consumerism Radio. And joining us from Minneapolis, Minnesota today is Andy Brown, President and CEO of Health Efx, an SAS provider doing some very innovative things to help employers manage the data compliance and management challenges that are really being put up by the ACA. Andy, good morning.
Morning, Doug. How are you today?
I'm great. Great to have you on the program.
Thanks. Pleasure to be here.
Yeah, appreciate you taking the time. Give our audience a little backgrounder on the company and what you're doing.
Sure. Happy to. Health Efx is, as you described, Doug, a SaaS-based management solution for the Affordable Care Act that addresses all of the issues around the data challenge presented to the employer. And in addition, the tracking, reporting, audit, and downstream benefits analytics that allow the employer and their advisors to get detailed and granular insight into both strategic decisions that are being made, not only around benefits offered, but risk and contrasting that risk to opportunity that sits within the ACA environment for them to manage to the most optimal cost and benefit outcome for their employees.
What got you to this niche? What was the driver behind it that you kind of recognized?
It's an interesting question. There's a number of drivers. Core to it would be the team that we brought to bear on the problem. It comes from really a few segments that are critical to this issue. The first really is the legislative and benefits perspective that our core partners from the insurance industry and very large employer market, multi-billion-dollar public firms addressing the compliance issues, where we had very detailed expertise that sat in Washington through the development of the law, that in fact were advisors to the issues that were coming out of the review of the law since the very early days of health reform. And while we're not political around the issue with a perspective one way or the other, whether this is good or bad, we recognized at the same time that this was going to present a massive data problem. In order to truly and fully manage the issues of the Affordable Care Act, it's much more than just determining eligibility under the hours counting perspective that's been the core focus of the market for at least the last 6 months, if not year. And it's really trending into much deeper issues for the employer and their advisors around what benefits decisions are being made, how that relates to risk, how you comply and manage that risk. And that's where the data problem becomes a big one. We saw in the market a massive gap in the nature of data, where it resides, its quality, the challenges in aggregating, vetting, and validating that to an audit format that allows the employer to truly manage the issue across the comprehensive data sets that present that challenge, be it payroll, HRIS, benefits data, leave management data, and really any other system that houses that data. It needs to be able to talk to each other in an environment that is then both can be audited to, in many cases, Sarbanes standards, that's HIPAA compliant, that allows for all of the downstream audit and reporting functions that are so critical to the employer under the ACA. But then from our view, much, much greater than that, the management and administration of benefits and risk around the decisions. So it's, an employer, while they may have a very focused objective on workforce strategy to control, employees to 30 hours or less if you're a highly variable employer, there's costs to that, and there's issues around strategic focus on benefits, how benefits are offered, whether under group or fully insured, self-insured models, whether under defined contribution and exchange models. And all of those things are brought to bear in the data that Health Efx presents for both the employer and their HR system and advisor constituents.
So Andy, you identified a niche that was, because there's a lot of human capital management, payroll, benefit admin systems that are in place and ingrained, particularly in large employers. So you identified where there's kind of a hole in a niche there that wasn't being served by some of these current solutions.
Yeah, that's exactly right. We, at the earliest, we've done this with other environments in healthcare and medical products and have been in formal commercial product development for up to 20 years with the core team that founded Health Efx. And, our focus on the issues really came from those three perspectives, the legislative side, the employer side, and then the data side. Mm-hmm. And when you dig in on the real issues the employer has to manage beyond the tracking issues that are so prevalent in the market today, we saw that niche as being one where the analytics capabilities that the employer is going to need and their advisors are going to need in order to affect good decisions around benefits being a very big driver. And that's certainly been a very strong niche that we've enjoyed substantial leadership in and have been awarded recognition in the market to date for having done so.
Yeah, congratulations on that, by the way.
Well, thank you.
Hey, Andy, this is Sanders. How are you today?
I'm well, Sanders. How are you?
Good, thank you. So would you mind sharing with us what are some of the distinctions that your company brings compared to other solutions in the marketplace?
Sure. There's a number of them. Most of the solutions that have been brought to market, in many cases, have been brought to market from existing HR platforms that exist. And in the first case, that obligates the employer to be on that HR platform. And as they're, tracking data, and tracking I define as, counting hours largely to, either the 30 hours a week or the monthly requirements under the ACA for determination of full time, has been a very strong focus for what the issue for the employer is. And while that's critical data, and it's certainly data that Health Efx facilitates as well, there's much more to the problem than can be facilitated exclusively with the data available in either a payroll or a Ben Admin HRIS environment. To fully grasp and handle all of this issue and manage the reporting requirements under 6055 and 6056 downstream, the 1094 and 1095 employee notices the employer will be obligated to, all of those issues require a much different data set, much more detailed issues around how that data is to be tracked on a monthly basis for annual reporting. And Health Efx addressed that issue from that disparate data perspective to aggregate and be able to manage all of those functions for the employer. So all of the reporting downstream that is IRS required is facilitated through Health Efx directly. But insofar as the eligibility determination goes, there's some fairly complex rules, as everyone understands. Mm-hmm. But the ability to manage multiple measurement periods really to an unlimited level based on employee category. All three safe harbors, again, because of the data that we aggregate from all of those system environments to a valid state of analyses, we are able to track all of the three safe harbors. And for a large employer, that can create a very significant swing in their plan pricing options in order to determine at what level to set plan pricing without incurring penalties. And it's surprising to many large employers when they run the analytics and reporting features in Health Efx to look at different safe harbor options across their specific employee populations, rates of pay, whether the W-2 safe harbor or federal poverty limit safe harbor is most effective for them. It can create a fairly significant swing that can add up to millions of dollars for large employers. And that, when you're addressing simply the tracking of hours and not considering those types of issues, that's data that is not available to those strategic decisions. Beyond that, we are also tracking all of the state rules that impact ACA, Medicaid expansion state by state. That is unique to Health Efx. And what really stands us apart from other solutions so far in the market is the benefits capabilities that the system has, the ability to look into the granular data, analyze by demographic, by entity, by strategic objective, by pricing and risk on penalties, and really setting in motion a much more granular management approach to the ACA and what effect it has on the employer. And that's data that is useful to the employer, certainly, and also to their benefits advisors, the decisions they make around, as I mentioned, group versus fully insured versus defined contribution or exchange directions. And then looking at the cost analyses around what if we maintain policies that are separate from ACA, if we have groups of employees or plan prices that affect the strategic benefit for the company but incur a risk, how do we manage that risk? How do we control that at the workforce level? Those types of things are much deeper questions than can be answered simply with hours tracking.
So Andy, it sounds like your solution, as in depth as it is around helping employers do this, is that you're not only exposing, but you're helping employers maybe see gotchas that they weren't maybe looking at before, right? Thinking they had their arms around it, but exposing things that they really, weren't truly aware of.
Yeah, I think that's a fair statement. It's an early stage in this market where it's governed by a lot of fear, and that fear is based on a lack of understanding. And we've certainly seen that as a driver in the market over the last couple of years, obviously. What has happened, though, and what is changing in the market a great deal is that the employer is much more sophisticated on the issues and the impacts of those issues. Mm-hmm. Their advisor, the insurance brokers, the TPAs, their benefits, EBO-type organizations they work with are much more knowledgeable now on what the implication of decisions are going to be around the ACA impacts on benefits. And there are a great number of opportunities that extend beyond simply avoidance of penalties. And that's where significant financial leverage exists for the employer if they have the data and can understand the impact of those decisions. That's really where our focus has been as a differentiator from other options where, if counting to 30 to avoid penalties is your objective, and the question is asked, well, what does avoidance of $50,000 in penalties by offering coverage to this segment of the population translate into increased benefit spend, and what value does that have to the company? Those types of answers don't come from data that is present in a simple tracking environment. There's much more to it than that. And the employers that we work with, when they begin to see what the possibilities are around how they not only target and manage their strategic objectives, but also meet all of the compliance and tracking and reporting requirements under the ACA, they begin to recognize that for approximately the same price point, they're getting a great deal more value.
Andy, what's your business model? I mean, I know you're software for service, so I'm assuming it's a monthly fee. What is the business model?
Yeah, you're correct. We have pricing that's based on employer size, right, and delivery mechanism into the market. There are three phases of this market as we see them. And the first one is really where the focus in the industry is now. We have direct contracting with the employer. Our pricing model is based on employee lives that are active per month, and that is a critical determinant for the employer because, of course, under the ACA, what you are tracking is active employees. Terminated leave employees are not considered that, but leaves must be managed for rehire issues around 13 weeks and then different levels for other types of industries. Sorry?
No, go ahead. I'm sorry.
And then there are other platforms that Health Efx has in development and that has released in certain cases that facilitate really multi-tiered SaaS delivery of the technology through third parties. Now, that is an area of the market that is evolving at present, but certainly one that we see a great deal of activity and interest in. But as mentioned, there are stages of this market. The sort of final stage of this market that we see is going to be where the need for the data for other applications downstream of this issue from the employer will be significant. And we're already transacting data with most of the major systems that are in the market, be they payroll, benefits, or otherwise. Even if they do have tracking capabilities, the employer ultimately is deciding who they're working with, and we are integrated with those systems, both upstream data, source data that transact to Health Efx, and downstream data to enrollment platforms, and most every one that you can think of in the market is transacting data that way.
Andy, I really, time flies when we're having fun. We'll have to do this again sometime, but it's been very informative, and I really appreciate you taking time out of your day to join us here on Healthcare Consumerism Radio. You have a great weekend up there.
Thank you very much for the opportunity. We'll look forward to speaking again soon.
Thanks, Andy, very much. And to the rest of our audience, stay tuned for the next segment, Healthcare Consumerism Radio.